and roll. Okay, so you remember she said that when you're going to start probing, you start up here. Number 1. This is number 1. You're going to go all the way this way, and you'll have to turn them. And then you'll come back lingual all the way this way. And then you'll jump down to here, all the way around, and then lingual all the way around. The what? Oh, you can do what it says.
So just take them out?
Unless you, is there water in there and
No.
stuff already?
No.
Okay, then just do them separate,
Okay.
if that's what it says. If you're just practicing technique to start with, just like if you want to start on a tooth just to practice technique, I'd probably practice on a bottom tooth, just so you can really see what you're doing. And remember, on the bottom, it's palm down. Hang on, I'm gonna put my chair down just a little bit. Palm down. Make sure you're standing up on your fulcrum. If you're too flat, then you're gonna have a hard time adapting your instrument. So stand up on your fulcrum. Get a good solid fulcrum, about 2 teeth away. If your fulcrum is too far away from the tooth you're working on, you'll be almost too flat. So make sure you're about 2 teeth away. Remember we talked about the distal line angle? So it's like the corner of the tooth, where the distal meets the buccal. There's like an imaginary line right here. So that's where you're going to insert. So once you're in, the tip stays in the pocket. And then we're going to do this nice rocking movement that we have been practicing, right? Rock with your wrist. When you get towards the distal, remember how we talked about the coal space? So you're going to angle it. Don't over angle. That's not going to give you a good measurement, right? So you're angling into the coal. Going to be able to record that measurement. You can continue to walk back up. So now we're looking for a measurement between this line angle and this line angle. So Bob, and you should have, be able to record your deepest measurement from there to there. And then you're going from the mesiofacial line angle to the mesial. So it's also right here, you also have to roll it just a little bit too. Once you're here, this is also a little roll to get into the sulcus interproximally. Back out. Stay in the sulcus the whole time. That one. You're gonna find that your end will catch on the tissue. If you are probing and you're seeing that whole tissue move, you're not adapted. You have to think about the roots of this tooth and how they're shaped down kind of like a cone shape. So when you're probing interproximal, you have to follow the shape of that tooth. If you're going too straight down, your tip is not adapted to the tooth. Another way you can practice where you can see what your tip is doing, you can practice above the gingival margin just to see where your tip is. So when you're moving like this, you should be able to keep your tip straight against that tooth. If you're coming in like this around that corner, where do you think that the tip of it's going to poke? you're going to be poking the gum. So you got to keep your tip adapted. So that tip has to stay adapted. If you're like this, you're going to cause some discomfort. So making sure that you're adapted. Into the cold.
And then where we're seated is, you know, surfaces towards, surfaces away. We still follow that structure as far as like when we're probing as well.
Yes.
Okay.
Now the anterior I think was different, but she wrote it on that sheet.
Okay.
Because when you get to the anterior, you're going to be line angle back into the interproximal, line angle, then you're going to come up to around the whole tooth, but you're not going to change from that away.
So you wouldn't be sitting up in 11 or 12 to do these anterior?
I think she wrote it down.
Okay.
But what about up here? Still sit right here? Or can you move up top to do these?
She wrote it down where she wants you to sit.
Okay.
Because I asked her about that this morning and I forgot.
On something we got?
If not, I'll look at my handout.
And then when we're doing the distal aspect of like the third molars, where do we know to stop? I guess the middle of the back
I'm very squeaky. Let me see what she wrote. I don't see it. I think you might be at 11, but we'll ask her for sure. But on the upper, remember your palm is up. On the lower, your palm is down. So again, when you think of the anteriors, it's canine to canine. Distal. You can come out as long as you go straight back into the line angle. Like using the wrist. And you have to kind of rotate and roll on your fulcrum to get it into the interproximal. And I'm stuck on something. 11 to 1, she said.
So you always start distal at that distal line and go distal, right? What happens when you cross over?
When you cross over, you have to start distal. You still start at the distal line angle. How do you want them to do that on the anterior? Still continue in that direction?
You're still gonna go here because you're charting. You're
Okay.
still gonna go from mesial to here, even though you,
So start at this line angle.
at the mesial,
Okay.
even though you put the line angle there.
And where do you want them to sit for anterior maxillary?
Actually, the textbook gives them either the rear or in the front, as long as they have a neutral wrist.
Okay.
So you must
So
have a
8 to
neutral
9. So 8 to 9, or
And what we mean by that, you can demonstrate it.
so if you are in a position where you have to bend your wrist like this, that's not a neutral wrist. You have to have your neutral wrist. Palm up. Enter into the line angle.
And the reason why you're still going this way is because your charting is going to be off. So you're still going to continue from that mesial to distal, even though you hit that line angle where the midline.
You can see your tip in there is adapted. It's up against the tooth, and your probe is following the angle of the tooth, right? And you angle in to get your cold. Now when you come around the lingual, you're gonna have to use your mirror. It's gonna take some practice. Okay, so when you first sit down, try an area that you can see really, really well and just kind of work on technique. Don't record your numbers yet, just kind of work on a little technique, and then we'll work on recording some numbers. Okay?
All the numbers you have to start here at the end of the tooth.
You can go back. So when you are on the lingual, you're coming around the lingual, you have to start on the distal. You're gonna have the fulcrum kind of up here. Starting on the distal, rock. And you're going as far back as where you can feel the coal. So it's halfway, like here's the tooth, half of the tooth. So you're going right back here to the halfway point. So distal, back. My angle. When you get to the coal, you have to give it that little bit of change in angulation. So your instrument, like if you were here, you would a little angulation so you can feel into the coal. But you can't over angulate like that or you'll miss the pocket. That makes sense? Now if you are doing your typodont, you've got to know to mark out this tooth. Just put a X through it. Throws off your whole probing. You'll get to here and realize you have one more tooth left.
She said there's nothing to stop, so I can literally go super far. But what we're doing is we're walking, getting caught on the calculus. Okay, so then you've got that distal line angle here. And then you're looking back around. And you've got that medial pocket, right? And then you walk out a little bit. You're going to continue walking.
Yeah, I want to show how you. I want to see how you like tilt a little bit. I think I cannot see it from here.
Okay. Alright, so I'm going to insert here with the distal line.
Yes.
It's harder in here.
Yeah. So in the pocket, you stop and maybe because you know like it's gonna be deeper.
Yes.
On the contour on the side.
Pretty much, yes.
Okay.
But when you are probing, I don't like this. These don't have the sulcus. You feel, thank you. You feel, because you're using a light pressure,
Yes.
where you have to stop.
Yes.
You're not going to push through their tissue.
Got you.
So you'll feel it.
Okay.
And like Ms. Martin said, it feels kind of like the resistance of pushing down on a rubber band. So it's just a tiny little bit of pressure. Then you're like, all right, that's where I stop.
Yes.
Okay, but you want to make sure.
Oh yeah, I saw how you tilted.
Yes.
Yes.
And then we're just walking. Sorry, this dude's got tartar everywhere. Alright, and then the same thing. And even, yes, sometimes, even when I'm probing, I'll think, I don't think I got as deep as I needed to, so I'll walk back out and then walk back in to make sure that I find that pocket
So you
depth.
go back and
Yes, so
Oh,
I'll just
okay.
walk backwards and then walk right back
Yeah.
forwards. Okay?
Okay.
Same thing. Hold still again. Alright, and then walking around. But once I have inserted, like once I've got my initial insert from that distal line angle, you don't have to like pull your probe all the way out to find the distal
Keep it
line
like
angle.
within.
Pull it out and find the distal line angle. Once you're subgingival, you're going to be able to walk your probe in between all the teeth without pulling it all the way from the tissue. All right, I'm going to go super slow. So I've got my line angle, subgingival. Okay, I'm going to walk backwards. And then I've got my 3. I'm going to walk forwards. And then it's like, okay, another 3. And keep going. And I'm using that roll technique with my fingers here to stay underneath the sulcus. underneath the gum tissue to roll it
Yeah.
all the way in to proximally. Same thing.
Does like how you were saying with the bend, you always keep it back, is it the same with the probe?
No. Well, yes, I guess it is. Yeah, it'll always be towards the back. I never thought of that. Except the anterior teeth. Yeah. But there's no way to hold, like you couldn't hold it the other way. Yeah, like you couldn't probe this way. It would be impossible. So you're always going to hold your probe this way. Okay. And that distal line angle. We're going to go back.
Can you tell them about their fulcrum placement?
Don't do what I do. So I've got my fulcrum finger here. Let's say I'm gonna insert it here.
You also important to know that for your next load, you're gonna have a pump up.
Yeah.
And you put that into the line. Give it to you.
Let's go to the bottom.
Yeah.
Alright, I've got my fulcrum here. Can you see? I was like, I need to come around.
Hold it.
Same thing. I've got that distal line angle here. I'm going to insert my probe. I'm going to walk.
Notice how her wrist. So remember, I think you were asking, what does your fulcrum do?
Yeah.
It's stable, but
It is.
a bob.
Right. Yeah. So it's moving without even noticing that it's
Correct.
moving. Yeah. Oh, it's bleeding. It feels like
Oh.
there's some red inside it.
These guys have lots of calculus.
You just move like
And I'll just readjust it when I need to.
And notice how she's hitting those zones. She's going from zone 1 and back, and then from zone 2 here. Mesial to mesial. Right?
So that retro pad here, do we go around it as well?
Yep, you go all the way to that distal line. From distal line, and we'll cover into that distal.
Okay, so we treat it as a normal tooth.
Yes,
Okay.
correct. So we'll demonstrate for 11 and 12.
I think I can do that.
You really good. I have to think real hard about it.
Yeah. I've been trying whenever she needs help. I'm like, let me put, yes, and
Did you
like kind
have
of
it?
switch. Yes, but I have to switch the hands. I have to switch everything. So we're starting at that distal line angle again. All the way back in her foot.
The one thing to think about though is to notice when she's probing. So if she stopped where she's at, remember I said you only read what you see,
Yeah.
right? So what probe number? So she took that out for just a moment. You see,
Three,
So
five,
that's
4.
3 and then 4, right? So if she inserted it again, what would be our probe reading?
4.
So that one in particular. So take
Actually,
it out. That's a 3.
Yeah, 3.
So see, it's 1, 2, 3, and she inserts. Then you're reading to 3. Remember, you don't worry about what you don't see.
Mhm.
It's only what's visible.
so the third notch is above.
What you would
that
record.
we-
Yes, ma'am. What's hidden, it stays hidden. You're only recording what's visible. Does that help everybody? Your forms and your charting method may change. Technique stays the same. That's the most important.
And you'll
That's
have,
why I said let's come in and let's mold it, because your technique is going to always be the same. Charting method can change as long as you know, okay, where am I charting from like facial to lingual, lingual to facial, but your technique does not.
and I'm gonna do the same thing on the labels up here. Can you guys see? Yeah.
Your seating in particular is going to be just like what you've learned. I have surfaces for it. I'm going to sit in my 8 to 9 or in my 3 to 4. Then I got my surfaces away where I'm going to be in that 11 to like 1 o'clock position. Everybody with me on that?
Mm-hmm.
So I found my distal line angle. I'm gonna walk my probe back.
Yeah, and then
Very distal, and then back up forward.
here we do a reading.
You guys see that?
Yeah.
Probing 3, 2,
You're not even moving your foot. How can you do that?
2, and then, oh,
5 is like that black is already immersed. Okay, so this is 2 now.
And so, sorry, I'm trying to find that again. I'm not all the way touching the big black band. I'm kind of in between the 3 and 4. But there,
So we go 4.
you go to the 4. Always go with higher number. This guy's stable. And you see me slip out a lot on this typodont. That's only because this tissue is weird. You guys won't slip out as much, and there's not going to be as much tartar on your teeth as there is on this guy. So it'll be a lot smoother, okay? But when you're probing, you just pick it up after practicing for a while, and you can literally probe the whole mouth in just a couple minutes. You guys will be very slow at first because it's hard to find your rhythm. I remember in hygiene school, I'm like, how am I going to memorize all these numbers to where I'm not having to stop and overglove and it's a pain. But you start off with like 2. Oh, I can memorize these 2 teeth. I can say 3, 2, 3 here, 3, 2, 3 here. Let me write that down, and then you'll realize, oh, now I can memorize 3 teeth, the sequence. So you'll pick up your own habits to where you're speeding this process along once you get comfortable with the whole process.
When you're on your anterior, what do we have between 8 and 9? Midline. So I want to show one thing. So remember we talked about you're going distal and then you're coming back around?
So if we're starting from that 2.
Correct. So from distal line angle going forward. Now when we cross this midline, what surface do we have here? Mesial.
Mesial.
Because of the way your sequence is from 1 to 16 facial, this is going to be from mesial to distal. So don't let that confuse you. You're still going in that sequence.
Yes.
But you cross
the naming.
midline, right? You're going to still keep going. But knowing mentally that this is a mesial to distal. Everybody with me on that?
Are we going back for every 2?
Yes, you're going to start in that line angle. So remember, you're starting in the line angle because it's difficult to start directly in the coal area.
Yeah, but if we're just going through that.
So you're not going to give me reading. You're just assessing for the coal area, and then you come back.
I think she means like once you progress, once you're walking, once you get to the next tooth. You know what I'm saying?
Like,
yeah, just if you can just do a stretch of teeth, just so I can maybe better explain.
So you come out in between every tooth.
Okay, it's clear now. So I just thought it's just to
Come
the
out for
one
each
that
tooth.
you go back and you just keep going until the end. As for each tooth, for
You have to
that
come
part,
out,
for part 1,
back.
you go back to measure that and you continue. Go back.
yes, ma'am.
Okay.
Mm-hmm.
Okay.
Does that help you guys here? For anterior. The next thing is for your anterior seating, your textbook tells you that you can sit in the actual rear area, or it says you can sit for 8 to 9, right? So you can sit here, or you can move here for like your 9 to 10 area. Now, caution yourself that regardless of which area you're sitting, because like even for your lingual, you can sit in the front or the rear is what your textbook tells you. You can, but you have to have a neutral wrist. What that means is my wrist does this, it's not neutral. And you need to palm up for your anterior.
In the
Or
middle.
your maxillary. Yes, you're going to have your mirror, but your maxillary palm is up. And you have to have a neutral wrist. So if we see that your wrist is like this, that's not neutral. Okay? Some adjustments have to be made, meaning that I have to change my patient over a little bit so that my wrist does this and I still have a palm up. So that means that this is still palm up even though I'm to the side, but this is a palm down. Okay? But if I got my patient turned so much like this, then I'm like here and I'm arching, then that's not neutral. But if I need to turn my patient this way to get here, and then sometimes you end up like this, that's also an error.
So we reposition ourselves.
You have to reposition yourself. Do I need to move over here for this? Do I need to go behind to make it straight? Okay, as far as like your 9 to 10 or 8, wherever you need to position to make sure that you have the neutral.
Which is the normal, the position we're learning, right?
Correct.
For every level.
But you have options for this anterior. I just want you to know that.
I
don't know if I have them.
Yeah, but then I don't really need it. There's nothing to retract here.
Any questions? Everybody good? I got questions. Let's show some